Hi, everyone, and welcome to another TGN live event. For those of you who are new to the Gypsy Nurse, we are the largest and most active online community for travel healthcare workers. We're proud to be a one-stop shop resource for travel nurses, whether you're new to nursing or have been doing it a while or getting ready to take the leap. We are here for you. We have tons of articles and videos like this to help you get started, a job board to help you find your next adventure, housing to help you find the next place to lay your head, and discounts and so much more. We do these live events once or twice a month with industry experts and other travelers to give our community a chance to ask their travel healthcare questions in real time with someone who knows a thing or two about travel healthcare. You can listen to this one and others on demand on thegypsynurse.com. You can just go to the events tab and check that out. Also, while you're on thegypsynurse.com, be sure to sign up as a member to be included on upcoming contests and receive updates on the infamous TravCon, which, if you don't know already, it's the largest healthcare in-person conference out there. And yes, I'm including you, Allied, and anyone that's interested in traveling, you need to be there. TravCon is full of education, fun, and an epic after party you definitely do not want to miss. And you don't even have to be a travel healthcare worker to attend. They have a newbie boot camp the first day. So to get you all prepped and ready for traveling, they have it all just dedicated to you. Be sure to save the date for September 17th to the 20th, 2023 at the Paris and Las Vegas. Early birds are actually ending on the 31st. So be sure to get your tickets. Tickets are about to rise up. So be sure to go get those. So moving on to our live event. Are you ready to start planning your summer assignment? There are many factors to consider when choosing a travel assignment. There's location, pay, credentialing, and more. It can be overwhelming when figuring out where to look or what steps to take. So to kick off summer, we have AMN here to share their tips on finding housing, making credentials easy, and the best way to find and plan your next travel assignment. AMN has this panel of experts ready to answer your questions and share their expertise on all things travel nursing. So be sure to give out lots of questions. I hear they're doing some giveaways. So let me introduce you to Audra. We have Melina. We have two more popping up here too, Tia and Carol. Thank you, ladies, so much for joining us. And I'm going to let you guys.
Thank you.
Yeah, of course. I'm going to let you take it away and hopefully get some questions.
Awesome. Thank you so much, Rachel. We are here again with the Gypsy Nurse. We are so excited to be here with all of you. I have a big round of thank yous that I want to start with, not only to Rachel and the Gypsy Nurse for hosting us, but a big thank you to everyone here listening live and those who will be catching up with us a little bit later. Another thank you, definitely nothing to, last but definitely not least, thank you to all of our nurses and Happy Nurses Month. Thank you to every nurse that works not only with AMN, but works with this amazing community, who's a part of this amazing community, nurses who have had the pleasure that we haven't had the pleasure of meeting yet, who we've had the pleasure of meeting yet, with all of you so soon. And for those of you who are new here, we have an amazing panel of AMN employees here today to help you answer all of your burning questions that you have about travel nursing, picking up shifts, finding and planning your summer assignments. And like Rachel said, we are here to answer your questions. So you can start answering all of your questions, or putting all of your questions in the chat. And as we go through this live event, we will be answering them as we go. And to make this a little bit more fun, although we are already a really fun group, we are going to be giving some prizes away. So I'm going to announce the first one right now. Are y'all ready? The first 3 people to ask their first questions in the chat will win an Apple HomePod Mini, a Keurig Mini, an Apple Watch, and a Lululemon fanny pack. So start commenting, start asking questions. And as those questions start to come through, we're going to do some introductions. So hi, I'm Audra. I'm your host today. I have been with AMN for about 4 years, and I work every day to enhance your experience on AMN Passport, our mobile app. But that's enough about me. Let's get to our amazing panelists here. Melina, I have you up first.
Hi, everybody. I'm Melina McCauley. I'm a Senior Director of Recruitment for our Travel Nurse Division. So happy Nurses Month. Thank you so much for all that you do for all of our patients. We are just so grateful for everything that you guys do. I've been with AMN for about 6 years, and I support a team of recruiters who work day in and day out to try and help you guys find the best positions that there are. And I will pass it over to Carol.
Hi guys, my name is Carol Silva. I'm a manager of recruitment here. I've been with AMN for 11 years, and I also do management and I do the recruiting side as well. I've done that for 10 years solely as a recruiter, so I have a lot of good information to share. And I also wanted to say Happy Nurses Month because we appreciate you guys more than you know. So thank you for letting me be here. And Tia, I'll pass it to you.
Thank you. Hi, I'm Tia Ellis. I am a senior recruitment manager with our local and per diem side. I've actually been with AMN for about 2.5 years, and I am so excited to be here today to be able to discuss some things with everyone. And I also want to say Happy Nurses Month, and we truly appreciate everything that you guys do for us.
Yes, thank you all so much. I know that everybody on this panel is here to answer all of your questions, and we will get to them. But I think it's best if we just start from the beginning. We have summer right around the corner. It's practically here, and we want to help you make the most of it. So Melina, let's set the stage for everybody on this call, on this event. How do we here at AMN set our travelers up, our clinicians up, whether you're brand new to traveling or someone looking for a travel assignment?
Great question, Audra. Well, we have a team of recruiters, as I mentioned, that once you have applied, and Carol's going to go through the roadmap on what specific steps you would take. But once you have applied and you are in the system, we get you set up with a recruiter. And that relationship is so crucial and so important. Really, that recruiter is going to be holding your hand through the whole process, the whole time that you're a traveler, whether you travel with us for one contract, whether you travel with us for 27 contracts, they're going to be your main point of contact that's going to be there really getting to know you, finding out what it is that you want out of traveling. Are you looking for pay? Are you looking for a cool location? Are you looking to go spend some time with a family member in a different part of the country and take a travel contract for that reason? So whatever that is, your recruiter is going to get to know you really well, and they're really going to be your advocate when looking for all of these jobs. So you'll have your recruiter, you're going to have Audra and the AMN Passport. My goodness, there's so much there that she can help with and that the Passport team has done so that everything's at your fingertips really seamlessly. You're going to have our customer support team, our clinical team, 24/7 support from clinical, which is really awesome. And also you're going to have our credentialing team. So you're going to have a whole team of people here to set you up for success. And to get into a few more specifics on what that will look like, Carol, share your expertise.
Yeah, I'm happy to help. So I'm going to go over just the overview, the roadmap of how to get started. I know some of you are new and you're like, where do I start? This is a lot to sink in. So the first thing you're going to do, just like they were saying, is you're going to download the AMN Passport app. It's super user-friendly, very helpful, and it's your portal to everything you're going to need as you travel. So that's step one. Then you're going to do the application. If somebody had referred you to AMN, one of your friends or family members, definitely be sure you put their name as who referred you, because we have a referral bonus program for the person who referred you. So super important to do that. Once that's done, you're just going to hear from your recruiter in probably a day or less. So be ready to answer that call. They'll be reaching out quickly. And then you'll be shopping through the Passport app as you go. So on there, you're going to see the locations, the pay rates, a lot of information, what's required for the jobs. And you can shop through there and really see what interests you, what's your true motivation, what are your top choices, what looks interesting, and then you connect with your recruiter on those preferences, and they will do their best to get you the best fit for you and your top choice. So that's what you'll do once you start shopping through jobs. You get an interview and an offer, and you lock in the offer that you're happy with. Once that's done, you do credentialing, just like Melina said. On the app, you can do your credentialing there. You upload your documents. It's really easy. And then you start your adventure. You go out to your assignment and you get to work, you do orientation, and you just keep it moving, make new friends, see new things, do fun stuff on your days off. And then about 6 to 8 weeks before your contract is done, you're already looking for your next contract. So things move very quickly when you're doing, 13 weeks at a time. And your recruiter's with you every step of the way, helping you find what you're looking for, help you with your time off if you need it, if you need time off in between contracts, any of that good stuff. And that's pretty much the roadmap to getting started.
Yeah, Carol, thank you so much. It really sets the stage for what new travelers can expect, or anybody that hasn't traveled with AMN before. So thank you so much. And Melina, you really touched on all of those points of we're here to create relationships and make sure that we create this adventure and the best possible experience for you as you browse your jobs on AMN Passport, as you are working with your recruiter, working through credentialing, and really we make it so seamless. We do have a question in the chat. So let's start off. Angel 111, thank you so much for dropping your first question. It says, when will we see L&D jobs in California that pay well? L&D is labor and delivery for those newbies on here. And I think, Carol, are you able to answer that one?
Yeah, there's definitely a maternal child health season, as you know, but we get high paying jobs and great options all year. So my suggestion really is to be on that app and checking for the locations that you like. And if you're really chasing the pay or you just want to be in California, again, you let your recruiter know, and you also put it on your preferences on the app. Because then it will send you jobs and things of interest to you. It'll be like, hey, are you interested in this one? And that way you can always keep an eye out, because there could be the perfect job any time of year, to be honest.
Melina, did you have something to add in there?
Yeah, I do think that, gosh, thank you for the question. I love that you said things that pay well. And that is such a subjective term as to what you deem as paying well. I know rates are a really hot topic right now across the board. And gosh, we were seeing in the height of the pandemic rates that none of us had ever seen before, understandably so. I mean, you all were walking into really a hazard type of a situation. And thankfully, we have come out of that pandemic and we are starting to see rates normalize a little bit. And we're not going back to pre-pandemic levels, but we are seeing the rates start to normalize. And I will say the rates are set by the hospitals, and they're set by each hospital individually. So you can think of your travel agency, and specifically AMN, as kind of the middle person between yourself, the clinician, and the hospital, right? So the hospital gives us the rates, and those are determined by a lot of different factors. So it's what is census at that point in time? How much do they need this specific specialty? So it's also based on specialties. As Carol touched on the maternal child health season, we often have seen those rates go up in that season. But as we're starting to normalize, we'll see, we don't really know where that baseline is yet for those rates to then go up with that seasonal inflection. But it's definitely something to keep your eyes on the website. And then keep in mind as well, geographical location, specialty, shifts, various different factors all go into determining those rates. So really great question.
Yeah, I love these questions. Everyone started off really strong here today. So please, again, the burning questions, continue to ask them. It looks Angel 111, you came back and said, I'm not seeing a lot of options there at this time. So definitely we want to connect with you. Let's connect with you. We'll get you in touch with your recruiter, and we will help you find what's best for you and the pay that you're looking for. I know that we also have Tia here. Tia is a part of our local staffing division. Do we have L&D jobs available on your side of the house, Tia?
We do. So we're the same as Melina said with local per diem. We're the same. It does depend on area, and it does come in for us for per diem sporadically. So it is about, for us, we're a little bit different. So for us, it's nursefinders.com, the website, where you're able to search the jobs as well and see the different per diem opportunities. And it does depend on what their needs are at that time, whether it's AM, PM, if they're just looking for help on weekends. So our website as well is something that I would definitely refer to.
Yeah, Angel One. Yes, thank you for asking your question. If you have any other questions, please let us know. We want to help you find your perfect L&D job. So there are definitely a lot of opportunities out there. There is not a scarcity of jobs, so we will definitely be in touch with you. And then we have one more question, Nick. Hi, Nick. He's asking, at what stage should the travel nurses start hunting for their house, or start their hunt for housing? I guess I switched those words, but it's fine. You get the gist. So yeah, we can hop into the housing discussion. Carol, I'm going to hit it back to you.
Yeah. So that's a great question, because housing fluctuates with the market too, and by the season. Some places, the seasons change the rates of Airbnbs and stuff like that. So my suggestion for finding housing is, as soon as you start shopping for jobs on the app, definitely be checking Airbnb and Furnish Finders and wherever else you look for your housing. Because when you're looking at your budget and you're looking at these rates, it has to make sense for you to go, right? Of course, maybe you want to go to Nashville or somewhere really fun, but maybe the budget that they have doesn't cover the rent cost during that season. So it's something to really consider. So if I were you, as soon as you start looking for jobs and you find a few that you are on the top of your list, I would go ahead and just jump on Airbnb real quick and just check out the prices and adjust your budget and see, okay, does this work? If it doesn't work, what else can we look at? And really dig in there. And it's fast. I mean, you can do an Airbnb search in like 45 seconds to find the information that you need. So I think really early on is in your best interest, so that you know what makes sense for you. And there's a lot of good options out there. So you just got to be patient and do that search, and your recruiter can help you too. AMN also has a housing team. Most people opt for the subsidy, because they want to choose their own housing and all that stuff. But if you wanted AMN to house you, we do offer a 1-bedroom furnished apartment. We pay utilities, furniture rental, and the deposit. So you just show up with your stuff. You don't get the stipend if you do the housing, of course, but it's a really convenient option. And our housing team has been around over 30 years and they're amazing. So a couple different things.
Yeah, Carol, thank you so much for speaking to all of that and talking about the stipend and what what AMN offers and how we can help. So Nick, if you have any questions, please feel free to reach out to us. We're happy to help you in your housing hunt. And yeah, we hope you find the best place possible for you. So, okay, we already touched on rates and housing. We are starting off super strong. I did want to circle back. So Tia mentioned a little bit about how the nurse finders and local division is a little bit different than the travel side of the house at AMN. So Tia, I want to give you the opportunity to kind of share what your house, I keep saying house because we were just talking about it, but what your house can provide and can expect when they're working with you and your team.
Thank you. So yes, so we're almost, well, I'm not gonna say we're almost, but local side is almost similar process with the way Kara explained for travel. So for us, for local per diem, we're more of that. If you're looking for flexibility, if you just need a break from travel and you're like, gosh, I want to go home for the summer. I want to be with the kids. I want to be with the family. You have so many events because we know summertime means pools, parties, cookouts. So it's all about if you're looking for a break. So with local staffing and per diem, we're more giving more of that flexibility. You're able to make your own schedule. You're able to sign up for the facility that you want. You're able to not have that requirement and set schedule, whereas you're required to do maybe 3/12s, 4/12 sometimes, but you want to be able to pick up whenever you want. So with local per diem, it gives you that flexibility. It gives you that ability to say, hey, I'll work tonight, or I'll work this weekend, or you know what, I need a vacation, or I'm going home, so I'm going from California to Florida. So a lot of times you want to have something planned up. So with local per diem, we're almost that same process. We are coming to Passport, so that's just an insight. But just so that you could visit nursefinders.com and start your application process as well. You can start your application when your application is completed, or if you are referred by a friend or family member, it's the same. You can either contact that recruiter that they work with, or go to that website and just put the person that referred you. So when you actually do your application, you are assigned a recruiter like me, and then we'll definitely contact you within that day, 24 hours, the most 48 hours. When we do contact you, we'll talk about your application. We'll talk about what you're interested in, what you're looking for, what we can help with, and give you so many different options, whether you want to stay in that state that you're currently on your travel contract with, because you don't want to go home yet and you like the area, or if you want to go home, you just like, I don't want to feel like looking, I need someone to help me, local per diem can help you with that too. And so, once your application is completed with us, we're more than happy to walk you through that step. So we're here from start to finish, just like for travel side is. So for us, we'll walk you through that application. We walk you through our credentialing with the amazing credentialing team that we have, walk you through that process, as well as get you on your assignment that you want, get you to per diem shifts, and we'll be here every step of the way.
Yeah, thank you so much, Tia. So it sounds like we are also just as flexible as we would love our travelers and our clinicians to be. We have the option to connect you with great recruiters like Tia on the local side if that's what you are looking for, but we also have long-term assignments available as well. One thing that you touched on, Tia, that I have a burning question about is referrals. So I know that you mentioned referrals, but what is the perk of referring someone to AMN? Melina, I don't know if you want to take that question from me.
Absolutely. We do have a referral program where if you refer someone to AMN within specific specialties and they're not in our system and we haven't connected with them in the past, we definitely offer a bonus. But outside of that, the coolest part is to bring a buddy on assignment with you. How much more fun is it when you go to a totally new location that maybe you've always wanted to check out, but you get to go with a friend, so you're not in it alone. You can also then share housing costs, carpool. Oftentimes, clinicians that travel together aren't on the same schedules necessarily, so carpooling isn't always working out, but it is really cool to be able to go to a new city and check it out with a good friend, bring a buddy. I know, Carol, you are very passionate about that, and you have a lot of travelers that bring friends with them. So share a little more about your experience.
Yeah, definitely. Travel pairs are pretty common. We even have travel trios sometimes. And just like she said, like, who doesn't want your friend to come with you on an adventure? That's the funnest thing. So yeah, you can refer your friend. You get up to $500 for each eligible referral, and there's no cap, so you can refer all your friends. And you guys can go on an adventure together. It's a lot easier if you have the same skill set, like if you're both telenurses, but if you're not, we can still travel you together too. And the only difference with travel pairs versus going on your own is that you have to be a little bit more flexible, because let's say you guys want San Diego, but there's only one opening, but there's two of you and you want to go together. So maybe San Diego isn't the one we can do at this time. So you have to be a little bit more flexible, but it's really fun. And you save money on housing because you're splitting housing. And it's a fun thing to do. And it's not always best friends. Sometimes it's married couples. Sometimes it's mother-daughter. It's all different people. So it's really fun. And you just work with your recruiter and we just check out jobs for you guys together and lock them in together. It's amazing.
Yeah, I love that so much, especially during the summertime. It feels like this is the perfect time to go traveling with your friend, but also making some money along the way. Y'all, do you have any bucket list locations that you would want to go to if you were a travel nurse? Tia, I'm going to start with you. I know I have some.
So I'm not from California, but I do want to see LA. I know it's a little busy. I know it's a lot of traffic, but I'm from New York, so I want to see the other half of the craziness. So that would be my vacation place.
Melina, do you have anywhere that you would love to go?
I would probably go to Denver. I think I've been there before and I absolutely love it. But gosh, living in San Diego, I love just the total change, being in the mountains and just really connecting with nature. And there's, gosh, so much to do all year round. So that's probably where I would go.
Rachel in the chat just said she wants to go to Hawaii. I second that, Rachel. What about you, Carol?
There.
Yeah.
We do have positions in Hawaii. Heads up. Go on the app, check them out. They're there. And there's a lot. So it's not just one sole job out there. I haven't been asked this question in so long. And as you guys were talking, I'm like, oh my gosh, where would I want to go? I think Maine, because like lobster rolls and how fun would that be? And maybe like up in the Northeast during the fall, because how beautiful. And I like fishing, so maybe Alaska would be on my bucket list. I had a traveler that was like, Alaska's on my bucket list, and she got to go, and I was so jealous. I was like, tell me about your adventures. So that was so cool. I tried to live vicariously through her, and she sent me pictures. It was amazing. So I might want to copy her on that one.
I love that. Nick also says Denver is pretty great and he's biased. So it sounds like, Nick, you're from Denver or you're there right now. So if you have any fun tips to share, please drop them in the chat. I guess I didn't even answer. I mean, I would love Hawaii, but the Carolinas is probably somewhere where I would love to spend the summer. It sounds really beautiful there. So sorry, I just felt like that was the right time to talk about that. I really wanted to know what everyone was thinking to take your best friend on your bucket list. Okay, anyway, so I guess now that we're talking about summer assignments, let's chat about the opportunities that we have right now and the best way that our travelers, our clinicians can find what's best for them. Is it about location? Is it about pay? Carol, do you want to go ahead and chat how you work with your clinicians or work with your recruiters to work with their clinicians on that type of question?
Yeah, definitely. So when you work with your recruiter, you're going to want to really be as honest as possible about what you really want, because they want you to have what you want. And some of the top locations and highest paid jobs, they go first, like they book up quickly. So if you and your recruiter are aligned together on the plan and your profile is up to date and ready to go, they can submit you right away, get you an offer right away, and you can lock in your top choice. So if you drag your feet on getting the references in, or you don't want to complete the application right away, we're going to miss out on great jobs. So speed to market is super important. You want to be the first applicant at the best job, but also like figuring out what your true motivation really is. It seems obvious, like everybody wants the same thing, but they really don't. Take it from a recruiter of over 10 years. I've heard all different reasons why people travel, and it's really fun to figure out everybody's motivation. Some people, I worked with a traveler and he wanted to go to the different baseball stadiums. And I was like, okay, I don't know much about baseball, but just let me know which ones are important and we'll get there, you know? And some people are retired and they like the flexibility. So they're more just taking them here and there, contracts whenever they feel like it. They're not really doing it for income. They just, want to still use their skills. And some people really are just chasing the highest pay. They're trying to pay off student loans, whatever it is. So we shoot for the highest paid jobs. Now, with that, if the highest paid job is in South Dakota, then you have to decide if that's what you want to do. But if you're like, well, maybe that isn't my true top reason I'm traveling, maybe it's a mix, then you just discuss with your recruiter and you go over the pros and cons of whatever you like and apply to a bunch and just see what happens. You never know. So
Yeah, I love that you even brought up South Dakota, because I definitely don't want people to take that off their bucket list. Definitely think about it, and if we have positions there that are available. Another thing that keeps coming up for me, and I haven't even talked about it yet, but AMN Passport. If you set your preferences in AMN Passport, when you log in, when you fill out your profile, when you complete your application in there, you can set your preferences for location or pay. And we will send you notifications to your phone when those are available for you and you're eligible and it's a right match for you. So we use our AI job match technology that we've built. So you're definitely always going to be, the first person or, in the know when those jobs are newly available and you're looking. So definitely for summer assignments, if you have something specific in mind, go set those preferences up and we will be pinging you when there is a job available that, you're interested in. So definitely get that set up. And then another thing that I'm going to circle back to is if you are already on AMN Passport, you can refer friends directly from there as well. So AMN Passport mobile app, go to a refer a friend link and you can submit there as well. Melina, do you have any tips and tricks for finding summer assignments or figuring out why your clinicians or your travelers want to travel? Like, what is their why and how do you get to the nitty-gritty of it?
Yeah, I mean, I said it before, and I'll circle back and say it's really just relationships with recruiters. I think about specific recruiters on my team who have been working with their clinicians for some of them 15 years, some of them even longer. So the relationship is so important just to, at this point, when they've been working with their recruiter for so long and they know their recruiter so well, that recruiter knows the second a job opens, oh, I know that this clinician will want this. I'm going to submit their file because they already have this great relationship. And then they will give them a call and, work out all the nitty gritty details or whatnot. But that's how they can ensure that they're not missing out on something, is that relationship. And really, to Carol's point, finding out that why, and making sure that you're really clear with yourself as well as with your recruiter as to what it is that is your deal breakers. What are your top priorities, and what order are those ranked in? Of course, all of us who work, we would love to get paid the most that we can, right? That allows us the freedom to do everything we want to do. But is pay your number one? Is that one you're not willing to negotiate on? Or maybe you are, because maybe location is number one. Maybe you're going to go be with a sick relative, or gosh, I think about one of my recruiters had a travel pair actually, and they were sailing around the world, and they were going to coastal cities and just stopping and living in their boat in coastal cities. So coastal cities were number one for them, but it's really all of that is done through building that relationship with that recruiter and making sure that both yourself and your recruiter are very, very clear on what the most important things are. So relationships and open, honest, transparent communication. And that goes both ways. That's what I expect from all of my recruiters, is that open, honest, transparent, timely communication with their clinicians. And that's what their clinicians, they expect from their clinicians. And they've built this really great symbiotic relationship with each other.
Yes, I love that. Open, honest, transparent. And that also goes for the local division as well. Tia, do you have any tips or advice on your clinicians who are looking to take local assignments this summer?
I do. So a lot of times we get a little nervous because we're like, oh, we're not doing travel. How can I make the money that I want? How can I make the money that I know that's going to help me basically survive and live in this world now? So a lot of times for local, it's not necessarily, you don't have to do a contract, because we also on the local side do local contracts. So if you decide, hey, I still need that guarantee, still need them 3 shifts to make sure that I'm getting the work that I need each week, we still do local contracts as well if you want to absolutely be close to home. So I also get, clinicians that come from our travel side that's like, I'm going home, but I need that work. So we could definitely submit you for a local contract, or we could start you on per diem. So for us, a lot of times, our clinicians, rates are important too, but a lot of times it is location for us, because it's like, I just want to stay home. I haven't been home for months, or I haven't been home for the last year. I've been staying in a different state, and I just want that comfortability, which is basically what a lot of clinicians for us is about. But never be afraid, because local will take care of you as well as travel. And definitely we're more than happy to help, especially with your recruiters. Just let them know what you're looking for. Let them know what you desire, because rates is important for us, location, but also you have to be comfortable. We want you to be yourself where you're at. So whether you need a break from travel, or even if we do have per diem clinicians that's like, I want to start traveling. So we do have that connection with our travel side to say, okay, let me get you to one of our travel recruiters, and they can help you so you can start seeing the world. So that relationship is there as well.
I love that. Yeah. If you have questions for Tia or Melina or Carol or myself, please don't forget we have a giveaway going on. So drop those questions in the chat. You'll be getting a Apple Mini Pod, a Keurig Mini, a Lululemon fanny pack, and an Apple Watch. So make sure you go through and ask more questions. We are here to help. And thank you so much, Tia, for talking about how the local side is able to support and provide that type of experience, whether they're on assignment with us or just looking to take up shifts or be per diem. One thing that keeps coming up for me as we all are talking through all of these great subjects is the impact that our travelers and our clinicians have on their communities. I know that it's Nurses Month, and that's a big hot topic right now, but truly, the impact that all of you have is the most important thing that we see as AMN workers. Like, I want to know if you have any stories, Carol, Melina, Tia, of how your clinicians or travelers make an impact on their unit or their patients or their family. I'm sure that with all of these relationships that we're building and curating, like, what do you see and what do you hear out there with all of our travelers and our clinicians?
I can start.
Yeah.
I mean, we get stories from our clinicians often, and I'm telling you, like, some of the stories have even made me cry. I'm like, oh my gosh, it's like, of course, we're all working and we're all busy and we're all doing the things, but sometimes you stop and you really remember how important this job is that they're doing and how tough it is. I think sometimes we can easily forget because I'm not the one at the hospital. I'm not the one having these hard conversations with people that are scared and all of that stuff. So we just appreciate it. Really, we do. And even us in our personal lives, whenever we go to the doctor, we always are so grateful for all the help and care that they put in. Really, like, not even being cheesy. This is truly, it's just wonderful. So we appreciate you guys. And I've gotten, I mean, stories from my travelers all over the place of the impact that they've made. But really, like, I'm just proud of what they do, and I'm happy to even get to work with them. In full transparency, I feel happy that I get to do that.
Yeah.
I will chime in here and say, gosh, there are times when hospitals have reached out to us to tell us how amazing our AMN clinicians have been and what a support they've been and how positive and how they've gone above and beyond and done something that's really impacted the hospitals. One thing I've noticed is that our clinicians are a little more selfless and not necessarily the ones to call and toot their own horns about everything that they're doing. So to echo Carol, thank you for all that you're doing. And really, it's so great. We hear from hospitals all the time about the amazing work that you're doing and things that, you're getting credit for that you're not necessarily asking for credit for, but that's really great to hear. And it's just, gosh, I think about when my sister-in-law was having my nephew and she had an AMN travel nurse as her labor and delivery nurse. And it was in the height of the pandemic in New York. So New York City, in Manhattan, in the height of the pandemic, it was around the time when they didn't know if people would be able to be in there, like if her husband could be in there or anything. She thought she was going to have to go through it alone. And this travel nurse literally went above and beyond, took such great care of her. She called me and said, I love AMN because they gave me this amazing nurse. She's the best. And just what an impact. And I was like, it moved me to tears because she's helping take care of my new little baby nephew and has no idea the connection to AMN, but was just providing this amazing service, going above and beyond to make somebody who was really scared in that moment, as I'm sure we can all understand, feel confident and calm. And so it's just so rewarding to be able to work in an environment where we get to hear these types of stories every day.
I love that so much. I won't name drop, but I believe there were a couple other AMN employees that work at corporate that just recently brought a baby into the world, and their delivery nurses were AMN travelers. So I just love hearing those stories. Tia, I saw you come off mute. Do you have anything to add?
Yeah, so our per diem nurses are the same. It's that relationship they built, and that relationship is so good. It's the fact that the hospital will reach out to self-scheduled clinicians just because they know how reliable they are. I agree with Melina, the selfless. They basically put the patients first. It's what we love to hear. So I have a lot of time my nurses are like, hey, I'm working these days because the staff in office called me or the charge nurse called me or the manager called me and she want me to pick up. So it's more of that our clinicians building that relationship and showing the hospital that they're there for them. Even though they're considered as agency, they're still treated like their staff.
Absolutely. And the impact that our travelers and our clinicians make on their communities is so important to us. So in AMN Passport, if you are a traveler, go ahead, download it. And you have an impact tracker now on the app to show you based on how many assignments you've taken, hours you worked. You can see your impact of how many patients in the community that you've helped. So thank you all so much for your impact. But y'all, we have another question. Are you ready for it? It's a good one. Stacy, thank you so much for asking. But everybody is, well, maybe not everybody. If you're new to traveling, it can be a little bit overwhelming at the start of your assignment. How do you deal and how do you suggest that your travelers deal with the overwhelming feeling? Like, what type of benefits do we offer? What type of support do we offer? Melina, do you want to go ahead and take that one for us?
Sure, absolutely. In addition to always call your recruiter, I can't tell you how many times my recruiters have been called on day one, and just take that deep breath and one step at a time. But through AMN, we also offer a variety of different resources that are there, external resources there to help you. Things like pet care, help with planning weddings, help with all different things in life that cause a lot of that external noise that can add to that overwhelmed feeling, especially when you're starting a new position. And we have, a whole entire program devoted to helping our clinicians with all those different types of things. Also, we offer counseling sessions for our clinicians and their family members as well. So there's a lot of different support resources, and that's just to name a few. For more, definitely connect with your recruiter and they can walk you through absolutely everything that we have to offer. But, feeling confident is so important, and making sure that you're mentally in a place where you're able to provide the care to patients that you want as a clinician and that the patients want as well, is so important to us. So we have a lot of different ways that we support.
Yeah, thank you so much, Melina. Carol, did you have something else to add?
Yeah.
Okay.
I was just going to piggyback on that. I mean, it's totally normal to be nervous for your first contract, of course, right? So it's kind of like when you're first going to college, you're like, okay, I know how to do this, but it's new and it's different and it's just kind of uncomfortable at first because you're like, what am I supposed to expect? So it is totally normal. But you go through all the emotions, but when you get there, you're just kind of getting back to work like normal. And then you get in the groove of it and you're like, okay, like no big deal. And once you have one contract on your belt, it's like no big deal. The ball just keeps rolling and you're like a pro very quickly. So I would say try not to be nervous because you have such a fun adventure ahead of you. It's exciting and nerve-wracking, but your recruiter will help you through it. And everybody goes through the same emotions. Like it's like a cycle. It's like first you're excited, but then you're really nervous. And then you start to pack your stuff and get ready to get in the car. And then you're excited again. You're like, I'm out of here. I'm going to have the best time. So it's really cool. So anyway, I think it's normal to be nervous, but we have a lot of ways that we can help you through it.
Yeah. Melina, I saw you come off mute again. Do you have something else?
Yeah, I was just thinking as Carol was talking, which she's so spot on, is that we also, if we're ever not here and you're trying to reach out to your recruiter and for some reason, maybe it's the middle of the night, that's where we do have that 24/7 clinical support where you can get in touch with someone through our clinical team if there's ever any type of a clinical concern or you're stuck and just like, oh, what do I do? So we do have that 24/7 available for you guys as well. And I think that's just really important to note because it's kind of unique, I'm finding, to AMN. So take advantage.
Oh my gosh, I'm so glad that you mentioned that. Yeah, so we definitely have that 24/7, 365 support. You can also go on to AMN Passport and submit any support questions there as well. So either on your phone, if you want to give us a call, email us. We are definitely here to be there for you. And like Carol said, it is so normal to be nervous. So just know that anybody else that you're meeting on that first day is probably feeling the same way as you. And that's where this community really comes together. And that's where those friendships are made. And that is where your experience starts and your adventure starts with maybe those little jittery nerves, but you get to meet all of these amazing people who hopefully help you calm those nerves. And if you have any questions about meeting people on your assignment or figuring out who is also an AMN traveler or clinician, reach out to your recruiter. We are so happy to connect you with those people that are also at the same facility as you, whether they've started earlier than you or starting on the same day as you. the community part is so, so important. So obviously that's what the Gypsy Nurse is also here for, making those friends, those connections, and really being a part of something bigger. So Tia, I don't know if you have anything to add about how you help your clinicians settle those first day nerves, or any tips and tricks there.
Yeah, so I was just gonna just jump in regards to, it's just an overall, if you're used to agency altogether, like if you're new to agency, you've never done, whether it's travel, local, we get them all the time. And I love being able to explain how agency, or we call registry, works. It's all about, you have that person to support you, which is us as recruiters. We have, just like travel side, we have a 24/7, 365-day extension center. If you had any questions, if a shift doesn't work out, if you need to cancel, if you need to, even if you want to pick up, we have someone that's here to support 24/7. You're never alone. You're never by yourself. So even if you're new to local, we have that conversation to where, what works for you? What can we offer? How can I help? What spots are you concerned with? Like, what can I make you comfortable with? So we have that support on local as well.
So needless to say, everybody on this call and beyond wants to help you feel comfortable and supported and safe as you start your assignment, on your shift, etc. So please do not hesitate to reach out, ask as many questions as you need, and we will be able to provide you with everything to feel comfortable on that first day. And with all of that, we have our 3 winners. So we are going to drop in the chat how you can claim your gift and how we will get them sent to you. So thank you everybody for asking questions and participating. It's been really, really fun. I just want to also state that in terms of community and feeling like you're a part of something, and getting to know your fellow travelers and healthcare clinicians, on AMN Passport, we have this really cool new feature where you can go in and watch other clinicians who uploaded videos about tips and tricks for assignments, their favorite locations that they've traveled, first time, what to pack on your first assignment. So make sure that you go and you check those videos out. And if you have something fun to share about your tips and tricks, or anything that you've learned along the way in terms of travel nursing, please upload the video. I know that people like Stacy and first-time travelers really find that useful and helpful. So again, check out AMN Passport for that community aspect and just getting to connect with everybody there. I have one more question before I wrap up. Everybody, Carol, Melina, Tia, what is your number 1 tip for our travelers and our clinicians when they are looking for their summer assignments? We've talked about a lot, but if you could wrap it up into 1 tip, what would you share?
I'll go first. My 1 tip that I would share is go for it. So during the winter, sometimes the rates tend to increase up. It depends on the year. But summer, I would just go for it. Go to the places that you want to see. Don't be nervous. Don't be afraid. Because when you're an old person, you're going to look back and be like, I'm so glad I did that. So my advice is just to jump in and get after it, because you will not regret it and you're going to have a blast.
I love that. And we are here to help you go for it. So yes, go for it. Melina, what about you?
I mean, gosh, Carol, I feel like you stole mine, but I would say, in addition to that, I would say, be flexible with yourself, right? When you're looking at all the different positions that are out there in the summer and in the winter, at any time of year, be flexible with yourself and challenge yourself. Why am I really wanting to travel? What am I going to get out of this? Where am I really hoping to go? And, talk to your recruiter about ideas that maybe you wouldn't have normally considered, because you might find amazing friendships there. I mean, I think about a travel pair that we now have who met while they were both traveling on assignment, coincidentally with the same recruiter. And then now they met each other on assignment, and now they are best friends and travel everywhere together. So you just never know where life is going to bring you and where traveling can bring you, which is kind of the beauty of it. So be flexible with yourselves, and go for it.
I love that so much. Tia, what about you?
So I'll sum it all up. It's don't be afraid. It's about, even if you have that fear, because we get a lot of it. Oh, I've never worked agency before. I don't know if it's going to work out for me. Don't be afraid. You can use agency as full-time opportunities. Just because we're agency doesn't mean that you can't get the hours and the travel that you want, because we're here. So my biggest thing is, don't be afraid. Even if you got to talk about it with your family, even if you got to talk to your recruiters, because we term recruiters as family as well. So definitely don't be afraid to take that step. And I agree with Kara and Melina. Go for it.
Oh my gosh. Well, I am here to just say go for it as well. And if you have any questions, please always reach out to us. I just want to thank you for tuning in to our Gypsy Nurse Live today here at AMN. We will continue to celebrate you this month and every month moving forward. Be sure to stay in the know on giveaways and news just by following us on Instagram at AMN Nurse to get started on your travel journey. If you haven't yet, or if you are new to AMN, be sure you download AMN Passport, our mobile app. That's where you can connect with community, connect with fellow clinicians, find that next summer travel assignment. And it's also your one-stop shop for everything. So 24/7, 365 support. Thank you all again. And we are going to pass it back to Rachel.
Thank you so much, ladies. That was some really great information. I loved hearing about all of everyone's favorite locations, and it was just a lot of great information.
Thank you so much for having us. We've had a great time.
Definitely. We love having you guys on. So I know you'll definitely be back. So thank you again. And thank you everyone that was in the chat and asked all the questions. They were all really great questions. So we'll see you all next time.